Good afternoon, everyone. This is Andy Reese. I see we have 134 participants with us. Thank you all for joining us again. We had a meeting with a number of providers on Tuesday and notified them at the time of some adjustments we're recommending to the Appendix K, which we should know something about, I'm hoping, very soon. We've drafted the suggestions that we had gotten and forwarded them on, and we will let you know CMS's response. It was addressing three issues. One was the issue regarding ensuring that there's adequate support for day retainer payments for all providers, including those providers who are residential providers and providing some support in the interim, but that they also get the support for their the retainer support to maintain their day service. Adjusting our hourly rates so that they are in line with the modified daily rates that we have in the regular rates. And we, based on feedback that we got from some folks, we've made some changes. We had indicated that the companion group rate seemed to be in line with the other direct support rates. Companion group, and anyway, it's in line with those other rates. But what people pointed out was that in using it for fewer than 3 people, that it was not working as well. And so we are recommending establishing a 1-to-2 companion rate and adjusting our 1-to-1 companion rate so that it aligns, I believe, with our in-home support rate. Someone was able to point out to us as well Tuesday afternoon that there were some, when they asked about our modified rates for all of our daily rates, and I indicated that the way that we modified them in effect would create a bump of about 15% of the cost of the direct support staff would be increased by about 15%, and that should be the effective increase of those rates. And when we looked at them, there were errors in that calculation. So if people are going to be submitting claims, please don't submit those claims from the published modified rates right now, because we'll be publishing new ones. If you need to submit claims, just submit the old rates, and then you can submit for an adjusted claim to get the difference as soon as we publish that other. And I'm really sorry about all that confusion regarding those rates. Just by way of an update, we do have updated data in terms of to date, there have been 145 people who have tested positive for COVID-19. Of those, unfortunately, we have had 20 deaths. Currently, there are 19 of those 145 people are in the hospital. 32 have received care in the hospital but have been discharged. 74 have tested positive but have never required inpatient care. We only received one question today, but we also had a conversation this week with one of our providers who had some experience in her prior life that really prepared her well and her agency well for doing the kind of groundwork necessary to prepare for this public health emergency when it came about. And we thought it would be very helpful if she could share that information with folks today. As I had said before, I think the most helpful is for providers to share with each other about the things on the ground that are working for them. So we've asked Beth Henson from Azure to speak with everyone today, and she can talk about her experiences. Her program has, I think, just supported living, but she can talk about how the different practices they've implemented that have been successful for them in their supported living placements. So, Beth, I believe you're unmuted.
Thank you so much, Director Reese. Good morning, everyone. Thank you for the time, Director Reese. Thank you, Deputy Dodson and Mr. Woodland as well for your interaction this week. It's interactions this week, extremely helpful. Let me tell you a little bit about Azure Healthcare Services. We are one of the little guys. We only have 6 supported living with transportation residential services within the District of Columbia. And we support 16 adults in those locations. A little bit about our company. We're a woman and a veteran-owned organization founded in 2003. And we have been just had an amazing experience providing these services over the years. Here's how, though, we were able to protect our people that we support and our staff from COVID-19. In our 6 locations, we have 0 COVID cases, thankfully. My background, as Director Reese alluded to, I was a commander in the United States Public Health Service. Our people to the community. So I've seen it from many sides. I also had first responder experience with Katrina and World Trade attacks.
Ms. Henson,
Yes,
right after you said that you were a commander in the Public Health Service, you dropped off for a minute. So if you could pick up there again.
Yes. Oh, I'm so sorry.
That was
sorry. Can you hear me well okay, now, sir?
Yes, we can.
Okay. I have a background as a commander in the United States Public Health Service. There, I served as a senior program management official at the Health Resources and Services Administration, Ryan White Care Act. I was on the first line with the mental health assistance teams deployed to Hurricane Katrina, the World Trade Center attacks, and many other domestic violence and terrorist attacks. We at Azure have been able to meld that experience into this current health emergency with COVID. One of the first things we did at our small agency, we only have 6 locations in the district, very small, is that our healthcare services department and the ownership, we set up daily management team video conferences to report out information to the clinical team, the management teams, to essentially assess the effectiveness of the new protocols that we had put into place. We needed to know if they were working. And we used the mayor's press conferences, orders, and COVID morbidity data to stay one step ahead of the spread. Our team in December, when we noted what the World Health was starting to report out of China, and we added it to the agenda for the management team meeting in December. And then in January, we sort of started to implement some of those things that we had talked about in December. So we started early. And we had these discussions internally about, laying out a plan to respond to COVID. What will we do if it started to take over the United States? We took it seriously. And like I said, by January, COVID was on the agenda. All the departments were discussing it. And we were developing guidelines to roll forward on social distancing, hand washing, and other techniques to avoid the virus, just like we would with flu or whatever else. And we implemented DOH guidance as it rolled forward. One of the third things we did was we instituted new staff protocols. About a week before the mayor's order for the lockdown of Washington, Azure Healthcare Service had already been in consultation with the Azure physician about the status of other group home providers in the city, the staff, and the people we support. Dr. Jean Welch strongly advised us to use face masks about a week prior to the mayor's order. All staff were advised before the lockdown to wear the masks and gloves inside their homes. We also instituted a central egress and ingress points within the homes. We did training on doffing and donning. No-touch temperature checks were put into place for staff and visitors before our lockdown. And again, hand washing and social distancing was stressed. The nurses did a magnificent job through video conferencing with the entire staff. They were trained via Teams and Zoom, and competencies were taken real time with the chat and with other tests that the nurses were giving them so that we could assess if they were understanding the precautions or not. These were just some of the novel approaches and training that we used for household protocols. Azure also contracted with a seamstress to begin sewing cloth masks for the ease and comfort of the staff working with the people that we supported. As the cases began to skyrocket within the District of Columbia, Azure management team decided to go into a lockdown of all locations based on the morbidity of the people in those locations. We based the decision on that with consultation again from Dr. Welch. I depended heavily on our quality assurance director, Mr. Ademola Davis, and Ms. Renee Fairfax to make it all work. So I needed to lean heavily on HR, heavily on the quality department to help me implement. On April 20th, wave 1 commenced. These waves are for 2-week periods of time. We use the holistics approach that we had heard of a few weeks back and decided on a 2-week period. Wave 2 began this past Monday, May 4th, and it commences on May 18th. We are currently planning to have wave 3 DSPs tested at Unity Health in Anacostia next week prior to deployment. The fifth point is that we use DC government business protection programs. Because Mayor Bowser had declared both an economic and a health crisis weeks prior, and through her decisive and thoughtful leadership, and from the City Council, Azure was able to secure the PPP programs and the SBA disaster relief programs as well. Sort of in wrapping up, I'd say for the duration of this public health emergency, we will continue to ensure the health, welfare, safety, security, and choice of these our people, the district's most vulnerable residents. We will follow Director Reese's mandates for DDS providers. We will follow Mayor Bowser's administration's directives and decrees, the DC Department of Health and the Department of Healthcare Finance recommendations to determine when the lockdowns will be ended. I really do believe, colleagues, peers, that we have everything that we need. My background is unique, but some of the pointers that I want to just say in the end is that your QRS is critical. Mr. Bradford not only checked in with us, but he also gave technical assistance. If I needed a clarification, all I had to do was call him on his cell phone. Immediately, he would get right back to me. And that helped quite a bit. And also following World Health going forward, I think we all should sort of be mindful in the months and years to come that we need to, we live in the world and we have to sort of have an idea of what's going on and what could potentially affect us. It sounded bizarre in December, but here we are in May. And the third thing is that each one of you on the phone has everything that you need right now to stay ahead. And if you've had cases, which most of us have, you're doing a wonderful job from what I understand in flattening the curve. And I really am proud to be a small member of this community. Thank you, Director Reese.
Thank you very much. you know, like I've said before, I know when we had another provider share, it's most helpful that providers are able to share with each other all these ideas. I wish you'd reached out to us in December. And
Yes.
but you know what I was thinking in terms of being well prepared is that we're nowhere near done with this thing. And so all of the things that you did learn about preparing are the kinds of things that people can still be implementing as we're moving forward. So thanks for sharing all of the steps that you took. And I'm so happy to hear that they've been effective with the people you support and your staff.
Thank you. We're grateful. And community partnerships are one other thing. Unity Health did rapid testing for us. They helped us sort of synthesize that administrative function to make sure we had those results back quickly, and we'll use them again. So reaching out, you know, beyond our comfort zone, not only, you know, always depending on the DDS for everything, is also a critical key to this piece and to this pandemic. So keep that in mind, guys, and I'll be quiet now.
Thank you. So we had just one question today, if I'm not mistaken.
Good afternoon, everyone. Has there been any thought about how DDS and the providers are going to reintegrate their people back into the community? For those who attend day programs, how will their staff work with them in terms of social distancing between each other? Where in the community will they go? At what point time frame will the disability community be exposed to the community?
So, you know, this is an excellent question. I've talked with a number of people about, you know, and I'm sure that everyone is aware that Mayor Bowser has launched the Reopen DC advisory group, which is looking at the process for DC reopening when the conditions are right. And what's very clear in all of those planning meetings is that what we are talking about is what the process is and not when the process is, because the when of reopening will be dictated by the conditions on the ground, by when we see, you know, that we have 2 weeks of reducing diagnoses, that, you know, that it seems to be more under control. Then we'll start talking about when we start implementing this move. The district is relying on guidance that has been provided by the Johns Hopkins School of Public Health about how governments can reopen. And as I look at that, I start thinking we need to begin having this conversation about what is day going to look like, because the reality is for many people that we support, it's going to be a very long time. You know, even as we start to reopen, the mayor in her press conference today talked about even when the federal government reopens, her hope that it will be done relying on a lot of teleworking. So even as we start to venture back out, you know, there's no longer a stay-at-home order and we can go out for things other than just essential purposes, we still need to be mindful of the importance of social distancing. And then the question becomes, what does that look like in terms of day services for people? You know, how do we provide meaningful days for people and ensure their safety, ensure that they can keep proper social distance, or, you know, ensure that they can stay safe as people we support, just like other folks who we know return to work, you know, as people return to activities that they enjoy during the day. Maybe helping people come up with new activities that they can enjoy that don't present the same level of risk in terms of exposure to other people. And so starting next week, the leadership at DDS will be meeting with the leadership in the Provider Coalition each week. And I hope that one of the issues that we'll begin talking about is this issue of what does day look like? And I think that it's a question that we're going to have to discuss among ourselves and then discuss with the people we support about what is this, how is this new world configured? Because I expect it's going to be a long time, if ever, before we get back to services looking the way they looked just in March.
And Ms. Hanson, we unmuted you.
Okay.
We have a question for you. When you instituted lockdown, shelter in place, did you continue to pay the rest of staff who were not working?
We unfortunately had to furlough the staff that were not working, that chose not to go on wave one. But we continued to train and interact with them to keep them engaged and beyond wave one. But we provided them with information and had a training call on how to apply, et cetera.
Okay, thank you.
Mm-hmm.
Can you please repeat your expected timeline for the updated enhanced rates, as well as when guidance about the day retainer billing will be published?
So just to clarify regarding the day retainer, we are asking CMS to amend the Appendix K. So we will let you know as soon as that's been submitted and approved. Those, as people may know, get submitted by DHCF. But they will submit it, and then CMS generally has been very fast in considering these requests and turning them around. I'm getting emails right now and was working before I came in here this morning to make sure that the enhanced rates are corrected. So those should go out early next week.
Okay, are there any other questions? Please text that in the chat box. Might not get it.
So another question for Ms. Henson. I think that was, did you experience a loss of staff due to the staff being furloughed?
Not that I'm aware of. All staff, hello?
We can hear you.
Okay, not that I'm aware of. Staff, we continue to engage the staff weekly, so not that I'm aware of. And we had quite a bit of discussion about the difference between termination and furlough. Quite a bit of discussion. So that went on for weeks, I would say, leading up to this.
Thank you.
Yes, ma'am.
Will DDS meet with day program leadership who are non-coalition members to discuss reopening plans?
Absolutely. So we do have a provider leadership meeting coming up later this month, but also as we, like I said, we have to have a discussion about what it's going to look like. So that's going to be discussions with all, engaging all providers, but also with stakeholders, with the consumers of this service, to talk about what it looks like and what it needs to look like for quite some time to come. So we should start having those conversations soon.
Did you say you will publish a new enhanced rate worksheet? Are the rates going to be increased?
Yes, and so people may have heard when we had our conversation on Tuesday, what I said was that the enhanced rate, we had modified the overtime factor to increase the rates so that effectively there would be enough of an increase that wages to DSPs could be increased by 15%. And some folks came to me after the meeting and said, everything we do does not calculate out to that. And what we realized was that there was an error in the base rate that had been used to apply that calculation that I just addressed. And so we have been correcting that and will be sending out revised rates that will reflect, it's not an overall 15% increase, it will reflect an increase that will allow the provider either cushion to preserve funds to pay overtime or the ability beginning March 11th to pay the increased rate, which would be 15% over the existing rate for the period of the public health emergency.
Some of the prior authorization day services are still canceled. What is the quickest way to get them reinstated?
If you could send me the list of the people that you're referring to at winslow.woodland@dc.gov, and we'll ensure that those are reauthorized.
Maybe she'll understand it.
Okay, and this, for Ms. Hanson, we have another question for you. Were those staff who were furloughed PE or TE?
I don't understand what that means.
Either way, that's why we figured it was for you.
PE, I'm looking at the chat, yeah.
Perhaps whoever asked that question could type out a little more explanation.
That'd be helpful, yes.
Hi, Patrick, if you could just let us know to clarify your question with the furloughed staff, PE or TE. Permanent employee or temporary employee? Okay. Were those staff who were furloughed permanent or temp?
We don't have any temporary employees at Azure.
Okay.
W-2, employees, if that answers the question.
Okay.
Yes, ma'am.
Thank you.
So far we don't have any other questions. I did want to make people aware that next week we will have, people I expect are aware, we have a community conference call in the morning from 10 to 11, and then we have this one from 12 to 1. Next week, we will have just one call from 12 to 2, and that will be to discuss our budget. The mayor's budget is supposed to be going over to council on May the 12th. And so we will have a presentation next week to talk about DDS's budget. And then on May the 22nd, the Committee on Human Services will hold a hearing. It will be for DDS, CFSA, and Department of Human Services. And on the 22nd, it will be for all public witnesses. And then on May the 26th, the executive witnesses will testify. So as a reminder, next week, we will have our budget forum for people who are interested in participating, and that will be from 12 to 2. And we will certainly we will do public, like, send out on our website and all kinds of public information to remind people about that forum next Friday.
And someone asked if that will be sent out via email, and that will be forwarded via email. So, yes.
Okay, well, I know we are, and I certainly know all of our providers are very busy people, so if there are no other questions, we can certainly end early. Once again, I do want to thank the providers for all the work that they're doing. Thanks, Ms. Henson, for sharing your experience today, but thanks to all the providers, and please convey that to your staff as well. We recognize that you're on the front lines of this crisis that we're all dealing with. And, we are attempting to be here to support you as well as we can. And so as you recognize, identify ways that we could be supportive to you, please let us know. We are all learning as we go in this, and we're doing our best to apply that knowledge and learning to improving the services that we are providing, that all of us are providing to the people we support, but also to ensuring their safety and the safety of all of your staff and ours. So we will talk to all of you next week. As I said, from 12 to 2, we'll have our budget forum. Thank you.